Hello, everyone. I'm so excited to come to you today. When I start waving these flags, you should know that something exciting is happening. My name is Davina Liggins, and I'm with Healing Made Whole. So what is so exciting? What has happened here today? So I've been working with a client, and we started working together toward the end of 2021 and the first 3 months of 2022. So she's a female, she's in her 70s, and she has been diagnosed with type 2 diabetes. She's had type 2 diabetes for a number of decades and have had many serious complications, including cardiovascular disease, impacts on her kidney function, eye issues. And she reached a point where she wanted to bring change into her life. And so, as I said, we started working together at the end of 2021. And what that looked like is that we did an extensive intake assessment. And basically, what that looks like is that we start from birth all the way up to the present of that time. And I'm collecting information in terms of any signs and symptoms, lifestyle habits, how you conducted your life. And what I'm doing is matching your lifestyle with what I hear you saying in terms of symptoms and how they progress chronologically over time. And so I'm looking for that root cause, the root cause in the lifestyle that is contributing or is indeed the sole root cause for that particular situation. And so when we started working together, we had weekly meetings from January of 2022 all the way until March. And basically that was just a lot of education, helping her to understand her lifestyle habits and the impact that it's having on her body, and particularly with the condition that she was dealing with. And so the whole goal and premise was to reformat or change or develop a new lifestyle pattern for her. So she went on, she changed her diet. She started doing intermittent fasting. And somewhere along the line, certainly in the last year, all of 2023, maybe toward the end of 2022, she started reporting to me that her A1C levels have been consistently dropping. So a couple of weeks ago, she shared her A1C levels with me, and she's at a 6.1. Her goal is for her next blood test, which will be in about 3 to 4 months. She wants to have it so that it is 5 point something. Her goal is to be in normal range. Her goal is to reverse type 2 diabetes and all of the metabolic complications associated with that, metabolic syndrome, and have a life of health. And there's two questions that I always ask this client. I say, just by making lifestyle changes, to the point where even her doctor has had to even change or lower her medication, how do you feel to know that you are in the power seat? You are driving that pendulum from type 2 diabetes all the way to health. That is a power seat. That is a wonderful place to be. And with the right education and encouragement, you can keep going. And I tell her there's no reason why you can't get down to 5 point something or get into that normal range. And if you keep going, see how far you can go. And then of course she has to find that maintenance, how she can maintain a lifestyle of health. And the second question that I tell this particular client is, because she's in her 70s, her early 70s, and I say, you can live until you are well into your 90s. That's 20 plus more years. What would it look like living with health and wholeness established in the body, driven by your lifestyle, versus a continuing or chronic progression of type 2 diabetes? And so she's choosing health. She wants to know what it would look like and feel like in her body to not have type 2 diabetes and to live in a state of health and balance. So she is excited. I am excited for her. Every time I hear great numbers from her, or whatever the numbers are, we get excited, we celebrate, we look for areas and where we can tweak and what we can do to help her progression and her journey moving forward. And so those are the questions that I have for you, those 2 questions. Do you know that you're in the power seat, especially when it comes down to these lifestyle diseases? You are in the power seat. You can begin to make changes, powerful changes that have a huge impact on your health. Question number 2, why would anyone want to age with disease in the body that can be prevented? If it's preventable, work to prevent it. Okay? And I do that in the context of helping people understand what they do and what they don't do and how that impacts the body and the balance in the body. So if you want to work with me, you can reach out to me. You can email me at Healing Made Whole. Like I said, we'll do a full intake assessment, and then we'll start working on a plan to help you achieve the goals that you are looking for, or at least start identifying what those root causes are. And like I said, she's been on this journey since 2022 in terms of intentionally changing her lifestyle. We're going into 2024 and she's not stopping. So I'm happy to work with you. Please reach out to me if you wish. Take good care.